So today we are going to talk an important topic that is diabetes insipidus, not diabetes mellitus. It is diabetes insipidus. Okay, what is diabetes insipidus and what are the uh, symptoms and how to see the clinical features? Everything. Let's discuss. So basically, we have pituitary gland. We know that. Okay, which is present in our brain. Okay, which releases most of the important hormones and also called it is the important gland in our body. Okay, and we have in the pituitary we have anterior and we have posterior. Okay, posterior pituitary glands secretes two hormones. One is we called antidiuretic hormone ADH, and another is in oxytocin. ADH and oxytocin. So these are the two important hormones which are released by pituitary gland. So one hormone that is anti-diuretic hormone, which is important during release of excess fluid from the body. So whenever excess fluid releases from the body, ADH activates. So what will it work opposite to the release of urine from the body. Okay, it will stop and it will absorb the important fluid which is excreted from the urine or by the urine. So it will absorb back. So our body maintain the fluid. Okay, then everything will be in of balanced condition, equilibrium. Okay, so what will happen in this case? In this case, anti-diuretic hormone is decreased. Okay, in this what will happen? Anti-diuretic hormone is decreased. So what will happen whenever anti-diuretic hormone decreases? So what will happen? The patient will have urgency in the urination. He cannot able to control urine, excess urine. Excessive urine is an disorder, okay, which will increase urination. Okay, so what are the reasons? There are numerous reasons. Okay, some are unknown reason. We have duty if it is due to the problem of pituitary gland. Okay, it we have to like pituitary carcinoma, pituitary tumor, pituitary uh, any infection in the pituitary gland, which leads to decrease of ADH gland or ADH hormone. But some cases like infection, typhoid infection, syphilis, or influenza virus. So in this things, what will happen? The ADH also decrease. But most of the male above 40 age will suffer from this type of diseases due to the more number of reasons. That some reason are due to the due to the prostate issues also, or due to the ADH gland ADH hormone decrease. This is also one of the reasons. What will happen? What will happen? We know that excessive urine. This is the clinical feature. Patient will appear to you polyuria. What is the symptom? Polyuria. This is the important sign. What will happen? And sometime nocturnal emission. This is a male condition in which the semen is ejaculated during night. Okay. Okay. So what will happen? The- Basically, how many amount of urine we evacuate from the body is 3 to 4 liters. This is a normal output. But in this condition, what will happen? The amount of urination will become 6 to 8 liters, the larger quantity. Okay, if you go 6 to 8 times a urination daily, but in this case, the patient will go hourly, half an hourly urination. Okay, so this will lead. What will happen? This will bring the weakness in the body, pain in the back. Okay, limbs will become very weak. Patient BP also decreases, and he doesn't able to lay down properly due to the pain in the lumbar region. Okay, and sometimes dry skin, dry skin, because all the fluid is going in the urine, and decrease in the temperature. Okay, so the warm temperature is going with the help with within the urination. Okay, so this is very important first. What will happen? We have to do the urine output examination. Patient have to ask the patient to how much amount of urination you are going throughout the day. You have to collect the urination and see the quantity of the urination is very important. Okay, and second is that you have to do the CUE test and quantity test of urine 24 hours to 48 hours. Collect the urination, or you have to measure the urination then throw it, no issues. Okay, and sometimes decrease the input of water in the body. Okay, all this you have to see the during the treatment. Okay, so all this will bring you notice that ADH hormone is decreased and you need to take the treatment. Okay, so this is all about diabetes insipidus. Will talk the treatment. No, no, okay, okay, I will tell you the treatment. RX part, RM part. Okay, I will talk remedies. In that, we have to give S6, L1B, and second one is if you this is exact cause of due to the hormonal imbalance. Sometimes you need in the place of S6, S2, sometimes S10. Okay, metabolism depend upon the condition. Next is if you are taking S2, C2. If you are taking S6, C6. If you are taking S10, you have to have C10. C10 when 1G. Okay. So this is the single before food protocol and after food protocol. Along with that, if the patient have sleep disturbance, you have to correct the sleep. If a patient have uh, drinking habit, I mean, drinking means water quantity is decreased, you have to increase the water quantity. If you are taking higher amount of water quantity, you have to decrease the water quantity. 3 liters is enough in a day according to the weight. Okay, you have to decrease 60 kgs, you need 3 liters. 80 kgs need 4 liters. 100 kgs need 5 liters of water daily basis. So along with new diet, sleep, and water quantity, you can manage this disease and gradually the patient will improve. Okay, so this is all about in today's class. We will discuss tomorrow diabetes mellitus. Anyone have any doubts? Kindly ask.